Uterine fibroids are non-cancerous growths within the uterus which can cause symptoms such as heavy periods, pain with intercourse, urinary frequency, constipation, and pelvic pain. Adenomyosis is a condition in which the inner lining of the uterus grows through the muscle wall. This causes menstrual cramps, lower abdominal pressure, and heavy periods. Treatment options for these conditions include no treatment, medication prescribed by your gynecologist, hysterectomy, and uterine artery embolization. Patients with fibroids may also have the option of myomectomy. Uterine artery embolization, also known as UAE, is a minimally invasive procedure in which blood flow to fibroids and adenomyosis is reduced or stopped by injection of tiny particles. Without blood supply, the fibroids and adenomyosis tissue will eventually shrink. The procedure itself takes about 1 to 2 hours, but you will stay here for observation for a few hours afterwards. Once you arrive for your procedure, our nurses will start an IV line for IV fluids and medications that will help you relax and make you sleepy. General anesthesia is not used for this procedure. We may also insert a Foley catheter to drain urine from your bladder prior to the procedure. For the procedure, a small access catheter will be inserted into an artery in your wrist or groin. Using an X-ray, the catheter is then guided to the artery that supplies blood flow to the uterus. Tiny particles are then injected into the artery, blocking off blood flow to the fibroids or adenomyosis tissue. Risks with this procedure are rare, but may include infection, bleeding, kidney injury from contrast, cutting off blood supply to the entire uterus requiring emergent hysterectomy, damage to the arteries, and infertility. Severe bleeding from the puncture site is rare, but if this occurs, it can lead to a heart attack or can be fatal. Depending on your age, UAE may also cause you to go into menopause. Before the procedure, we will obtain an MRI to assess your uterus and its blood flow. An ultrasound study will also be done to make sure the artery in your wrist is healthy enough to puncture for the procedure. You will be asked to complete blood work 7 to 14 days before. It is also important that you have a driver for the procedure because sedation is used. If you have an intrauterine device or an IUD, it needs to be removed by your gynecologist prior to the procedure. If you take Lupron, this will need to be discontinued for 3 months before the UAE procedure can be performed. If you take metformins for diabetes, you will be asked to hold it the day of the procedure and 48 hours after. If you take blood thinner medications, you will be given a specific time frame to hold this medication as well. The procedure itself is not painful. However, expect to experience severe cramping for 4 to 6 hours after the procedure. We will have you get up and walk around, which will improve your pain. Pain medications will be provided for you while you are here in recovery and after you leave. Some of these medications can cause constipation, which can make cramping worse. We recommend that you take Miralax and drink plenty of fluids after to prevent constipation. For 7 to 10 days after the procedure, you may have cramping, low-grade fever, muscle aches, and nausea. This is called post-embolization syndrome. Post-embolization syndrome is your body's reaction to the reduced blood supply to the uterus. After the procedure, we ask that you take it easy for a few days. It is extremely important that nothing is inserted into the vagina for 30 days to reduce the risk of infection. This includes sex, douching, tampons, and baths. Showers are okay. You will be able to return to work within 10 days. For the first 30 days, bleeding is unpredictable. You may have heavy bleeding, light bleeding, or no bleeding at all. After the procedure, you will have a 10-day follow-up, 3-month follow-up, and a 6-month follow-up. Before the 6-month follow-up, you will have a repeat MRI to ensure the fibroids have decreased in size.